is always based on following few procedures, principles, and practices, and wildlife is not an exception. There are standard operating procedures and practices involved in the wildlife veterinary care. Dr. Arun is going to explain it to us in detail about the same.
Wildlife forensic investigation is also part of wildlife veterinarian's job when it comes to any kind of poaching or disease or even illegal trade. So sometimes it is expected from a wildlife veterinarian to conduct a proper investigation, because the vet will always have a better understanding and knowledge about their anatomy, pathology, and their behavior. So this is very crucial for any wildlife veterinarian to investigate such kind of forensic issues along with the forest department or other departmental or other laboratory related experts together. So the important points are the evidence preservation and chain of custody. To get and preserve the evidence and the chain of custody, the meticulous collection of the evidence is again first and foremost important, as it may be presented in legal proceedings. And the chain of custody is maintaining a clear documentation of chain of custody for all evidences, because again it has to be unaltered and it remains same way so that it will be presented in front of the court. And minimal handling, the limited physical handling of the evidences so that it prevents contamination, and document any unavoidable handling with appropriate notes. So the other important point is the scene documentation. We have to take a detailed notes, even sketches and photos of the crime scene, even with better resolution cameras, so that we won't miss any evidences in the crime scene. And noting the animal's position and injuries and the way it was surrounded with other evidences, whether it is a pug mark of another animal or human evidences, or the presence of any other tools or even objects, or even poaching material, or even traps, or any relevant information surrounding the carcass or surrounding the crime scene has to be documented properly. And the photographic evidence, as I said, we have to take multiple angle pictures, and better to have a high resolution images, or even the carcass or even the environment, and any other tools like weapons or any kind of objects used for that illegal trade should also be properly documented. The environmental content, as usual, like your temperature or even the habitat type, and evidences of human activity or any other species, or even the pug marks, or even the samples, or a hair sample, or even a fecal material or urination, all such kind of evidences including pug marks should be collected. And the third point is the post-mortem examination. When the necropsies are conducted, it only determines the cause of death, and it is important to understand the cause of death, whether it is an outside injury or an internal injury, or some kind of evidences of gunshot injury, or even intraspecific or interspecies aggression, or some diseases even. So all these things are going to come under the cause of disease, cause of death. And the careful collection of sample is to make sure that the cause of death is supported with our sample collection, or even the sample was subjected for various tests, whether it is a regular serological or even a DNA based analysis. We have to substantiate the death by using various laboratory investigations through adequate sampling. And injury analysis, sometimes we have to differentiate whether these death or injuries were from human beings or from any other species aggression or even natural causes, whether it is a predation or even disease. And the fourth one is the species identification and DNA analysis. So many a times in the crime scene or in the forensic investigation, we may not even know which species we are dealing with, and sometimes it is very difficult to even gather a grass carcass to understand this is of particular species. So the species identification and DNA analysis is very important, and ensure that the species confirmation in that endangered or protected area based on their identification and their marks or even the size, we need to ensure. Because the species identification is very important, because the penalty varies as per the Wildlife Protection Act. So identification of the species is very important, and the genetic analysis to prove that the species identification was correct, and it is only through the DNA material, and we have to ensure that the species is identified and the source population or the link with other crimes can also be correlated. And tissue marking and labeling, again, proper labeling of all the samples with the time, locations and the type of sample or case number, or to avoid cross-contamination and ensure samples can be tracked back to the investigation. So this is again a complexity involved in any kind of investigation with respect to illegal poaching or trading. And the other topic is the toxicology testing. So we all know that now the common crime scene problem or even this mortality, whether it is individual or mass mortality, we first suspect the toxic components, and we always have the challenges of conclusion, because some of these toxicology report comes as a qualitative report. So interpretation of the qualitative report is very, very challenging. When it comes to quantitative, then at least we should know the lethal dose of the population, or even ED50 by LD50 matters a lot, and there is no such conclusion available as on now, because we can always come to an acceptable parts per million, or even the accepted amount of toxins in the body may or may not cause the mortality. So this is again a challenging field, and these chemical residues needs to be sampled properly, because the potential poisons or even pesticides or other toxins could indicate poisoning and as a cause of death. And the sample storage is again an important area when it comes to toxicological investigation, because the samples in an appropriate condition, where sometimes it has to be frozen and to prevent degradation or potential toxins. And the collaboration with the lab, as we always know that there are very important labs which are very important or very specific to certain targeted toxins, and many a times whether the forensic related things will be done in CCMB Lacan's Laboratory for the Conservation of Endangered Species, and IVRA Bareilly, and even in centralized university laboratory Cull of Tanoa's University always takes up this work and gives wonderful interpretation of these toxicological reports, which we can always rely. And also it is important to ensure that the relevant authorities or specialists should always release the interpretation or sign the report, which should carry a lot of value, and it should be always professional, and the professionalism should be followed even if we are supporting or interpreting a result and giving a report to a forest department or to a veterinary fraternity doing wildlife practice. The other important point is the injury pattern recognition. So it is important to understand whether it's a lacerated wound with the evidence of the trap around it, or some kind of snares around it, or electrocution mask or gunshot injuries. So all those things has to be done, and when it comes to any kind of gunshot related stuffs, we have to always take a ballistic report from concerned department, so that it will have more professionalism and more scientific in order to even accuse or in order to put case against an offender. The animal behavior knowledge is also very important when you are finding out the injuries, whether it is a natural cause or a predatory attack or intraspecific aggressions or conflict, or sometimes even human caused harm. So the weapon impact analysis, as I said, has to be done in a very scientific way, so that the tools used or the weapons used will always help cracking the case easily, and it is easy to track and find the perpetrators. Handling live animals in forensic cases, it's a non-invasive technique because handling animal directly causes major stress to the animal. So collection of non-invasive samples and then analysis or even diagnostic modules like DNA swabs or radiology or ultrasonography makes the vet use the animal, the live animal in a very non-invasive method. And behavioral assessment like signs of abuse or distress that may indicate previous mishandling or even ill-treating of these animals can be easily identified. The very common example is the bestiality. And temporary care, when we give temporary care for the injured animal under the forensic cases, ensuring their health is stabilized before any additional examinations are needed, and it should not have any kind of issues when it was in captive care or even the rehabilitation section. The other important point is awareness of legal standards and protocols. It is always important to follow standard operating protocols, even established forensic protocols and guidelines that are admissible in front of the court. And knowledge of the wildlife law, as we already discussed, that the significance of forensic findings and the impact of interpretation plays a major role here. And expert testimony preparation, so it should be better prepared to provide expert testimony in court explaining forensic findings clearly and objectively, so that the non-specialist can also be identify the importance of the wildlife conservation. And interdisciplinary collaboration, as we always know that the collaboration with the law enforcement agencies, forensic scientists and legal term to ensure the comprehensive investigation is done on the achievement of wildlife conservation. And sharing of expertise, the guidelines of law enforcement on specific needs such as proper handling of these carcasses or evidence storage or relevant testing should be done in an unbiased way, so that there should not be any kind of bias when we approach by involving multiple departments. And cross training is also a part of the better achievement by doing law enforcement to improve forensic techniques and understand procedural requirements for evidence collection. The ethical consideration and professionalism, we always discuss about that the impartial approach, so that there won't be any bias or even assumption should not be there when it comes to the forensic cases, and it should be always based on the evidence. We don't need to assume or we don't need to take any biased approach towards this evidence collection. And animal welfare should always be prioritized, so that the animal welfare should never be compromised, and always respect the dignity of the dead animals. So the evidences will be properly recorded and then preserved before we produce in front of the appropriate authorities. And as we always talk about, reporting and documentation is carry much value. An accurate document and then upholding the highest standards of professionalism matters when it comes to the wildlife forensic investigation. The public health and biodiversity comes as the last point, and the biohazard precautions, use of appropriate PPE to prevent zoonotic diseases transmission, and when the diseased or dead animals are handled. And sample handling, follow biosecurity measures to sample transport, storage and disposal of prevent contamination and disease spread. And public health notification should also be done in a potential way. Diseases like anthrax or avian flu to the appropriate authorities for containment is also a major part of wildlife investigation for forensic purposes. To conclude this, wildlife veterinarians involved in wildlife forensic investigation has played a major role in uncovering and documenting wildlife crimes. Their work helps ensure that justice is served in cases of wildlife crimes and supports their broader mission of wildlife conservation.
Just I wanted to emphasize on the disease outbreaks with respect to wildlife and what the veterinarian should be keeping their head focused on those areas, because it is very important when it comes to zoonotic diseases, and we already have discussed about the One Health program. So India has recently experienced several notable disease outbreaks affecting both wildlife and human populations. These incidents underscore the critical need for vigilant monitoring and proactive measures to safeguard public health and biodiversity. One of the important such outbreak is, as we all know, Nipah virus outbreak in Kerala. In September 2024 this year, Kerala reported multiple cases of Nipah virus infection, resulting in at least 2 fatalities, including a 24-year-old student. The Nipah virus is a zoonotic pathogen transmitted from animals to humans, often through direct contact with infected bats or their secretions. So human-to-human transmission can also occur, particularly in healthcare settings. The symptoms ranges from fever and headache to severe respiratory issues and encephalitis, with a high mortality rate up to 75%. In response, authorities have implemented contact tracing, quarantine, and public awareness campaignings to contain the outbreak. The other important outbreak which we have encountered in the recent past was avian influenza, our very well-known H5N1 strain of avian influenza in Kerala. In April 2024, again this year, an outbreak of H5N1 avian influenza was detected in ducks in Alappuzha district of Kerala. To prevent the spread of the virus, authorities culled over 60,000 birds within a kilometer radius of the outbreak's epicenter. Farmers received compensation for the culled birds. Avian influenza poses a significant threat to both poultry and wild bird population, with potential implications for human health. The third one is Chandipura virus outbreak in Gujarat. Many of us may not be even aware about this, but since June 2024, Gujarat has faced an outbreak of the Chandipura virus, resulting in at least 38 deaths, predominantly among children. This virus, transmitted primarily by sand flies, can cause encephalitis, leading to brain swelling and, of course, epilepsy, and rapid progression to coma and death within 24 hours. With no specific treatment or vaccine available, the fatality rate can reach up to 75 to 76%. Healthcare authorities are focusing on vector control measures and public education to mitigate the spread. Yeah, the next important notable disease, as we all know, is our well-known COVID-19. And it is a severe acute respiratory syndrome coronavirus 2. So it's shortly referred as SARS-CoV-2. Is a strain of coronavirus that causes COVID-19, the respiratory illness responsible for the COVID-19 pandemic. And this SARS-CoV-2 is a strain of the species, comes from a beta coronavirus pandeminicum, as is SARS-CoV-1, the virus that caused the 2002 and 2004 SARS outbreak. These are animal-borne coronavirus strains more closely related to SARS-CoV-2, the most closely known relative being the BANAL52 bat coronavirus. Its close genetic similarity to bat coronaviruses suggests it emerged from such a bat-borne virus. Anyway, the research is going on as to whether SARS-CoV-2 came directly from bats or indirectly through any intermediate host. The virus shows little genetic diversity, indicating that the spillover event introducing SARS-CoV-2 to humans is likely to have occurred in late 2019. Of course, all these outbreaks definitely need a very specific and a strong preventive measure and recommendations. And few of them I really wanted to discuss here. The first one is surveillance. Enhanced monitoring of wildlife and domestic animals to detect and respond to zoonotic diseases promptly. And the second preventive measure is public awareness. Educational campaigns to inform communities about transmission risk and preventive practices are really important. And the third preventive measure is biosecurity. As we have already seen in another session, that implementation of strict biodiversity measures in farms and markets to prevent disease spread is again a responsibility of every individual citizen. And the fourth preventive measure is the research. The ongoing studies to understand the ecology of these viruses and develop effective vaccines and treatment. So in conclusion, these outbreaks highlight the intricate link between wildlife health and human well-being, emphasizing the importance of a One Health approach that integrates human, animal, and environmental strategies.